NHA CCMA Practice Test 2025 Official Study Guide, PDF. Question 1. RN/O refers to which of the following? The bladder, the rectum, the kidney, the spleen. RN/O is a combining form that means kidney. Question 2. A disease that causes the bones to enlarge and become deformed and weak is called kyphosis, Crohn's disease, lordosis, Paget's disease. Paget's disease of bone disrupts the replacement of old bone tissue with new bone tissue, causing bones to become fragile and misshapen. Question 3. Standards of behavior considered appropriate within a profession are called morals, etiquette, philosophy, laws. Professional etiquette refers to the unwritten rules of conduct and behavior expected in a professional setting. Question 4. Sebaceous glands are examples of holocrine glands, apocrine glands, merocrine glands, mammary glands. Sebaceous glands are holocrine glands because their secretions are produced by the rupture of the plasma membrane, destroying the cell. Question 5. Which of the following words is misspelled? Rickettsia, streptococci, mycoplasma, mycobacteria. The correct spelling is mycobacteria, not mycobacteria. Question 6. According to the American Hospital Association, which of the following guarantees that the patient has the right to refuse treatment, to the extent permitted by law? Defensive medicine, patient's bill of rights, mandatory report, consent. The patient's bill of rights outlines the rights to which patients are entitled, including the right to refuse medical treatment. Question 7. An element that increases resistance to tooth decay is iron, iodine, zinc, fluoride. Fluoride strengthens tooth enamel and helps prevent tooth decay. Question 8. Eating a large amount of food in a short time without subsequent purging is referred to as binge eating, dumping syndrome, bulimia, anorexia nervosa. Binge eating disorder involves episodes of consuming large amounts of food rapidly without the compensatory purging behaviors seen in bulimia. Question 9. The most common combining vowel is I, U, O, A. In medical terminology, O is the most frequently used combining vowel to connect word roots. Question 10. The torsion of a loop of intestine, causing intestinal obstruction, with or without strangulation, is called intussusception, diverticulosis, volvulus, regional entrythes. Volvulus is a twisting or torsion of a portion of the bowel around its mesentery, which can cause obstruction. Question 11. The CCMA credential is awarded by the AAMA, AMT NA, ARMA. The Certified Clinical Medical Assistant, CCMA, credential is an exam and certification offered by the National Healthcare Association, NA. Question 12. When an oocyte and sperm fuse together, the result is called an zygote, oogonium, gestation, cleavage. Fertilization occurs when a sperm and oocyte fuse, resulting in a single diploid cell known as a zygote. Question 13. Which of the following vitamins is called pyridoxine? Vitamin B2, vitamin B6, vitamin B9, vitamin B12. Pyridoxine is the chemical name for vitamin B6. Question 14. The universal donor blood group is known as type O, Gub, A, B. Type O blood, specifically O negative, is considered the universal donor because it lacks A and B antigens. Question 15. A small, membranous structure found in most cells that forms the carbohydrate side chains of glycoproteins is called the mitochondrion, Golgi apparatus, Endoplasmic reticulum. Ribosome. The Golgi apparatus modifies, sorts, and packages proteins and lipids, and adds carbohydrate chains to form glycoproteins. Question 16. A tightness and narrowing of the prepuce on the penis that prevents the retraction of the foreskin over the glans penis is referred to as epididymis, phimosis, perineum, acrosome. Phimosis is a condition in which the foreskin is too tight to be pulled back over the head, glans, of the penis. Question 17. Choreopraxy is a procedure to centralize a pupil that is abnormally situated, remove both testes, widen a bronchus, remove the uterus. Choreopraxy is a surgical procedure to correct a displaced or abnormally situated pupil. Question 18. Which of the following conditions is caused by the lack of melanin pigment in the skin, hair, and eyes? Keratoses, albinism, leukoplakia, lithiasis. Albinism is a genetic disorder characterized by a complete or partial absence of melanin pigment in the skin, hair, and eyes. Question 19. Balanitis is an inflammation of the cervix, epididymis, glans penis, vagina. Balanitis is the inflammation of the glans penis, the head of the penis, often caused by infection or poor hygiene. Question 20. The suffix oma means disease, tumor, inflammation, enlargement. In medical terminology, the suffix oma denotes a tumor or neoplasm. Question 21. Which of the following is the best source of vitamin C? Yogurt and cheese, soybeans, fruits, liver and egg yolk. Fruits, especially citrus fruits, are among the richest dietary sources of vitamin C. Question 22. Which of the following terms relates to a male reproductive disorder? Mastoptosis, onychomalacia, ankylosis, cryptorchidism. Cryptorchidism is a condition in which one or both of the testes fail to descend into the scrotum. Question 23. Which of the following terms explains the relationship in which both organisms benefit? Commensalism, symbiosis, mutualism, parasitism. Mutualism is a type of symbiotic relationship where both interacting species derive a benefit. Question 24. An abnormality of the red blood cells, in which they are of unequal size, is called poikilocytosis, hemoptysis, homeostasis, anisocytosis. Anisocytosis is a medical term meaning that a patient's red blood cells are of unequal size. Question 25. A negatively charged ion is known as a N cation, ionic bond, anion, covalent bond. An anion is an ion with a net negative charge, resulting from gaining one or more electrons. Question 26. A ridge, wrinkle, or fold, as in the mucous membrane lining the urinary bladder, is known as a ruga, trigone, lobule, uvula. Rugae are a series of ridges produced by folding of the wall of an organ, commonly found in the stomach and urinary bladder. Question 27. Which of the following means the matter has been decided? Respondeat superior, quid pro quo, residential ipsa loquitur, residential judicata. Residential judicata is a Latin legal term meaning a matter judged, indicating a matter has been finally decided on its merits. Question 28. The process of attributing unwanted feelings to someone else is known as projection, regression, displacement, repression. Projection is a psychological defense mechanism in which individuals attribute their own unacceptable thoughts or feelings to someone else. Question 29. A major somatoform disorder that involves an actual physical disturbance is known as conversion disorder, personality disorder, bipolar disorder, schizophrenia. Conversion disorder is a somatoform disorder in which a person experiences blindness, paralysis, or other symptoms affecting the nervous system that cannot be explained solely by a physical illness. Question 30. The power plant of the cell that provides energy is called the ribosome, lysosome, Golgi apparatus, mitochondrion. Mitochondria are known as the powerhouses of the cell because they generate most of the cell's supply of adenosine triphosphate, ADP, used as a source of chemical energy.